You know that moment your dog is happily trotting along, maybe chasing a ball, and then, for just a second, they do this funny little skip. It's so quick, but it's enough to make you stop and think, wait, what was that?
Yeah, that sudden hop. They'll lift a back leg up for a few steps, almost like they're skipping rope, maybe give it a little shake, and then poof, they're back on all fours, running around like nothing ever happened. It's a really weird thing to see, and of course, your mind immediately goes to, is that bad? Should I be worried?
And you know what? It's totally normal to feel concerned when you see that. But the good news is we're going to clear it all up. In the next few minutes, you're going to understand exactly what's causing that skip and, more importantly, what you can do to help your little buddy out. All right, so let's dive in. What is really going on with that funny little skip?
Okay, so the fancy veterinary term for this is patellar luxation. I know it sounds super complicated, but I promise you it's not. It really just means a dislocating, or what I like to call a wandering kneecap.
See, the patella, that's just the kneecap, is a little bone that's supposed to slide up and down in a nice smooth groove at the end of the thigh bone. A luxation is simply when that kneecap temporarily pops out of that groove. That's it.
Here's the easiest way to picture it. Think of a train on a track. The kneecap is the train, and that groove in the bone is the track. Normally, the train just glides smoothly right where it's supposed to, but with patellar luxation, the train momentarily derails. It slips right off the track, and that's the moment you see that hop or skip. Now, vets actually grade this on a scale from 1 to 4. Grade 1 is super mild. The kneecap is in place, but you could push it out. Grade 2 is what most people notice. That's when it pops out on its own, causes that classic skip, and then pops right back in. By grade 3, the kneecap is actually out of place most of the time, and that can cause a more consistent limp. And in grade 4, the most severe, it's permanently out and can't be put back, which really changes how they walk. So who gets this? Well, it's mostly a genetic thing. We see it all the time in small and toy breeds. Think Chihuahuas, Yorkies, Poodles, and in those little guys, the kneecap usually slips toward the inside of the leg. But it can happen in big dogs too, like golden retrievers, though their kneecaps tend to slip to the outside. And believe it or not, it's not just for dogs. Some cat breeds, like the Devon Rex, can get it too. Okay, so let's get practical. What are the things you should actually be watching for at home? Well, the biggest one, of course, is that classic skip or hop we've been talking about. You might see your pet suddenly running on 3 legs for a moment. Ever see them kind of kick their leg out to the side? That's actually them trying to pop their own kneecap back into place. You might also notice they're having a harder time jumping up on the couch, or in really bad cases, you might even see a kind of bow-legged or crouched stance because they can't quite straighten their knee out all the way. All right, so you've seen a few of these signs and you decide to head to the vet. What can you expect? The great thing is, figuring this out is usually very straightforward. Your vet's going to start with a gentle physical exam. They'll carefully feel the knee and can usually tell right away if the kneecap is moving where it shouldn't. From there, they'll figure out the grade. They might also suggest an X-ray. That's not really to see the kneecap pop out, but more to get a good look at the bone structure and to check if any arthritis has started to develop. After that, you'll walk out with a clear plan that's made just for your pet. And that brings us to the best part, the path forward, because the news here is really good. There are fantastic options for managing this and giving your pet a wonderful, happy life. So generally speaking, there are 2 main game plans. For those milder cases like a grade 1 or 2, where they're not skipping very often, we can often manage it without surgery. This usually involves things like keeping them at a lean, healthy weight, maybe some physical therapy, and joint supplements. But for the more severe grades, or if the skipping is happening a lot, surgery is usually the best bet to actually fix the underlying problem for good. So what does surgery do? Well, remember our train track analogy? The whole point of the surgery is to fix the track so the train can't derail anymore. This might mean making the groove deeper, or realigning the tendon that pulls on the kneecap, or even just tightening up the tissues around the joint. It's all about correcting the mechanics so everything works the way it's supposed to. And here is the most important thing I can tell you. The prognosis is excellent. Seriously. With the right care, whether that's careful management or surgery, the vast majority of these little guys regain full use of their leg and get right back to living a happy, active, totally normal life.
So, if there's just one thing you take away from all this, let it be this. Don't wait and wonder. If you're seeing that skip, getting it checked out by your vet early is the absolute best thing you can do. It helps prevent long-term problems like arthritis and just sets your pet up for the best possible future.
Remember, this information is for educational purposes and is not a substitute for professional veterinary advice. If you have any concerns about your pet's health, please consult with your certified veterinarian. They are your best resource for ensuring your companion lives a long, happy, and healthy life.